As we embark on respiratory season, one local pharmacist has decided not to offer flu and COVID-19 vaccines.
And for more on this, we are joined by Kiro Masse, a pharmacist and owner of Lawler and Rylander Pharmacies. Kiro, thank you very much for taking time to speak with us about this issue. Okay, what exactly is happening?
Small correction. I did not make this decision. The ministry basically made it for me by not supplying me with vaccines to provide for my patients.
Right. Can you elaborate on that? Like, what exactly is happening and how did we get to this point? Can you elaborate on that?
Sure. So every year it's been extremely challenging for us to provide publicly funded vaccines. So that's flu and COVID vaccines. There's a lot of challenges in providing this to patients, and that's why a lot of pharmacies have actually opted out of providing these vaccines. We continue to do so, but this year the Ministry of Health, for some reason, has decided to provide us or have the distribution be done entirely through Shoppers Drug Mart distribution centers. And I don't think that this was a business decision per se, as many would claim. I think it was just a poor decision all around, and ultimately they're just not equipped to provide for that many pharmacies. And we're seeing it on the ground. So when we would need, for example, 200 doses for the week, we would get a giant ice box and it will contain 20. And we're not able to manage our staffing. We're not able to manage our calendars to provide for these patients. It was already very challenging, and now I feel like someone is working against me when I'm trying to serve patients. I'm not the enemy here. I'm trying to help. So all I'm asking from the government is to help me, to work with me, and to distribute this in the same manner that they have done before, which is through their regular distribution channels.
Yeah, you've called this sabotage. You also say the vaccine rollout this year has been the worst that you've ever experienced. And this really struck me, you've posted about this online, that sometimes massive shipping containers are arriving totally empty.
So what kind of message is that to me as a healthcare provider? Okay, if I'm trying to serve, like you have 60 appointments, you have 70 appointments on a single day, you have, arranged for extra staffing, and then you don't have doses. And then you have at our Rylander Pharmacy location out here in Scarborough, these are some very vulnerable patients. A lot of them are diabetic. They're patients with heart disease, okay, low socioeconomic. These are the typical patients that you would see in the hospital come winter with flu complications or COVID complications. And we got 20 flu shots to provide for them for the week. Is this a joke? And then you get bombarded by 100 calls a day for people asking for flu shots. Some people may actually start to get aggressive and do get aggressive because they are getting mixed messages. On one end, the government is telling them, go ahead, get your vaccines. On the other end, there are none. So what are we supposed to do? I thought I'd be the last person to walk away from providing publicly funded vaccines, but here I am.
Can you talk more about the communities that you serve, the people in those communities who rely on your pharmacies, not only for just general face-to-face interaction with the pharmacist and, consultations, but also these vaccines per se?
So there's a lot that we do. And over the pandemic, a lot of people might have seen my face. We administered thousands of vaccines with the help of community volunteers and very committed staff. And we've done things that most pharmacies don't do. So I've done everything from dropping by an ALS patient's home to provide a vaccine for. Just last week, we provided the flu shot for a patient who has leukemia in their home. These are the things that we do. It could be snowing outside, and there's a child in a wheelchair inside their parents' car. We're administering in the car. We're going above and beyond because people depend on us, okay? But when someone throws a wrench in the entire process like this, it really makes me question, are you working with me or are you working against me, okay? And who suffers the consequences at the end when our hospitals are completely crippled in the winter season? Okay, that's all of us. That's all of us. If my daughter fractures her leg in December, how is she supposed to see a doctor when all of them are being strained left and right with pneumonias that could have been prevented if we actually provided vaccines when we should have? It's a no-brainer. Everybody loses from this, and it's a very simple decision, and we had the answer, and it worked, okay? But for some reason, someone decided that they should change the entire distribution process and, in essence, reinvent the wheel. This didn't need to happen. Nobody needed this. And when we asked the government to do something and not go ahead with this decision, the answer was a blatant no. We were stonewalled. Why? Okay, again, I'm asked, why am I being treated as, like a force to be working against when I'm trying to help?
Okay. Kira Massé, I can hear the frustration in your voice. I do appreciate you making time for us. And I should also note that CP24 will be reaching out to the Ministry of Health for comment as well. Kira, thank you for your time.
Thank you for having me.